Welcome back, dear learners. Today's topic of discussion is anti-arrhythmic drugs. So, anti-arrhythmic drugs are the drugs which are used to treat or prevent the irregularities of cardiac rhythm. So, on the right hand side, you all can see there is a graph which is depicting the electrocardiophysiology of heart, and it is ranging from minus 90 MV to positive 30 MV. It comprises of phases. First phase, that is depolarization. Next is repolarization. Next is plateau phase. Next is rapid repolarization, and then again depolarization. This we have already discussed in the class about the electrocardiophysiology of heart. Now, anti-arrhythmic drugs, how they are acting to treat the irregularities of cardiac rhythm, we are going to learn from this presentation. So, anti-arrhythmic drugs are used to prevent or treat the irregularities of cardiac rhythm. So, why anti-arrhythmic drugs are used? It is being explained here. Now, arrhythmias are severe diseases that are almost one of the important cause of cardiac death. So, on the right hand side, you can see that again a graph has been plotted with various phases where the various class of anti-arrhythmic drugs have been applied in different phases of the electrocardiophysiology of heart for the treatment of anti-arrhythmia. So here class 1 drug is the sodium channel blocker, class 2 drug is the beta blocker, class 3 is the potassium channel blocker, and class 4 is the calcium channel blocker. So example of sodium channel blocker, quinidine, lidocaine and flecainide. Class 2 beta blocker, propranolol, metoprolol. Class 3 amiodarone, sotalol, and class 4 calcium channel blocker, that is verapamil and diltiazem. From this picture, you all can understand that how the various anti-arrhythmic drugs are used in the different phases of the electrocardiophysiology of heart. So, let's see the mechanism of cardiac arrhythmias. So, first what happens? There is enhanced or ectopic pacemaker activity, which means what? Ectopic impulse may also result from current of injury. As a result, the slope of phase 4 depolarization may be increased pathologically in the automatic fibers. After that, what happens? After depolarization, that is EAD, that is early after depolarization, and DAD, that is delayed after depolarization. In the early after depolarization, we can see that repolarization is occurring during phase 3 is interrupted and the membrane potential oscillates. And in the delayed after depolarization, what happens? After attaining the resting membrane, the potential, a secondary deflection is occurring. And last, what happens? That is re-entry, primarily due to abnormality of conduction, an impulse may recirculate in the heart, and this causes a repetitive activation without the need for any impulse to be generated, and it is known as the reentrant arrhythmias. So, the basic mechanism of cardiac arrhythmia consisting of 3 steps. First, ectopic pacemaker activity. Second, after depolarization. And third is again the re-entry. Here you can see in the various antiarrhythmic drugs for the class 1, how they are acting. They decrease the slope of the phase 0 depolarization. Then the class 2, they causes the decreased slope of phase 4 depolarization and causes a prolongation of the repolarization of the AV node. Then class 3 causes prolonged repolarization and class 4 causes prolonged repolarization of the AV node. And this way how the antiarrhythmic drugs are acting to treat the disease arrhythmia. Next is the various important cardiac arrhythmias. Here only the names you have to learn, that is extrasystoles, paroxysmal supraventricular tachycardia, that is PSVT, atrial flutter, atrial fibrillation, ventricular tachycardia, torsades de pointes, ventricular fibrillation, atrioventricular block, that is first degree block, second degree AV block and third degree AV block. So these are the different types of cardiac arrhythmias. Now what is atrial flutter, that is AFL? It can be regular or irregular and it is usually an abnormality of conduction within the atria. The atria beat more frequently than the ventricles. So atrial flutter is the abnormality in the conduction of atria. Next is atrial fibrillation. Atrial fibrillation, in short we can say AF, is always irregular and there is a complete absence of a sinoatrial stimulus which would result in a P wave. And the atria beat out of coordination ventricle. This leads to a rapid and irregular heart rhythm. And in atrial fibrillation, the heart rate ranges from 100 to 175. And the atrial flutter is less common than atrial fibrillation. So in atrial flutter, there is abnormality in the conduction within atria, and atrial fibrillation is the irregularity in the heart rhythm. Atrial flutter may be regular or irregular, but atrial fibrillation is always irregular in nature. So this way, the different types of cardiac arrhythmias have been explained. So here is the main topic, that is classification of the anti-arrhythmic drugs. So let's see on this first part. Here see the main 4 types, that is membrane stabilizing agents, anti-adrenergic agents, that is beta blockers, agents widening action potentials, and the calcium channel blockers, and these are the others. So here when you are asked to write the classification, you have to write in this format. Now under membrane stabilizing, what they are doing, there are 3 types, that is 1A, 1B and 1C. 1A is causing the moderate decrease of dV by dt of 0 phase. This is causing the little decrease and this is causing a marked decrease of the 0 phase. And these are the name of the drugs, that is quinidine, lidocaine, propafenone. These are the common drugs. Anti-adrenergic drugs, same you all know, propanolol, esmolol, sotalol. Agents widening the action potential, amiodarone, and calcium channel blocker. This is also known to you all, that is verapamil and diltiazem. Here is also the antiarrhythmic classification given in a tabular form. You can write in this way as well. Now here with each class of drug I have given the mechanism of action. So class 1A, that is antiarrhythmic drugs that are acting on the membrane stabilizing agent. Example of drug is quinidine. It is a dextroisomer of the anti-malarial alkaloid quinidine that increases the PR and QT intervals and tends to broaden the QRS complex. And there is a change in the T wave. How is the mechanism of action? Quinidine binds to open and inactivated sodium channels and prevents the sodium entry or influx, thus slowing the rapid upstroke during the phase 0 and decreases the phase of forced spontaneous depolarization, inhibits the potassium channels and blocks the calcium channel. Now, so the main action of quinidine is it is blocking the sodium ion entry. Next is class 1B antiarrhythmic drugs, membrane stabilizing agent, example lidocaine. The most prominent cardiac action of lidocaine is suppression of atomicity in ectopic foci, means the enhanced depolarization it prevents. How it acts? It blocks the inactivated sodium channel more than the open state. In addition, the sodium channel is blocked and lidocaine and mexiletine shorten the phase 3 repolarization and thereby decrease the duration of action potential. So this way the class 1B antiarrhythmic drug is acting. Next is class 1C antiarrhythmic drugs, which is also acting on the membrane stabilizing agent. Example is flecainide and propafenone. These are the most potent sodium channel blockers with more prominent action on open state and the longest recovery times. So what they do? They markedly delay the conduction, prolong the PR interval, broaden the QRS complex, and thereby the variable effect of action potential duration is obtained. Now, how this flecainide is acting? It suppresses the phase 0 upstroke in Purkinje and myocardial fibers, and this ultimately causes a marked slowing of conduction of cardiac tissue with a minor effect on the duration of action potential and refractoriness. It also blocks the potassium channel, leading to increased action potential duration even more than propafenone, and propafenone act by blocking the sodium channel considerably depresses the impulse transmission and has profound effect on the Purkinje of His as well as the accessory pathway conduction. So this way how they are acting on the various channels, especially the sodium channel blocking, is being mentioned for class 1A, 1B and 1C antiarrhythmic drugs. Next is class 2 antiarrhythmic drugs, that is the beta blocker. Example of drug is propranolol, sotalol, esmolol. These are the beta adrenergic drugs you all know. These drugs diminish the phase 4 depolarization and depresses the atomicity, prolonged the AV conduction and decreases the heart rate and contractility. They are also used in treating the tachycardia arrhythmias caused by increased sympathetic activity. They are also used for atrial flutter and fibrillation and for AV nodal reentrant tachycardia. So these class 2 antiarrhythmic drugs are the beta blockers and they causes the phase 4 diminish of depolarization. Example is propranolol, sotalol. Next is class 3 antiarrhythmic drugs that are amiodarone. How they are acting? They are blocking the potassium channels, diminish the outward potassium current during repolarization of cardiac cells. As a result, they prolong the duration of action of potential without altering the phase 0 of depolarization or the resting membrane potential. Now, this amiodarone, unusual iodine-containing, highly lipophilic, long-acting antiarrhythmic drug exerts multiple actions. Now these actions are what? It prolongs the action potential duration and the QT interval attributed to block of the myocardial delayed rectifier K plus channel. So the basic function of this class 3 antiarrhythmic drugs, example amiodarone, is to block the potassium channel. And last is the class 4 antiarrhythmic drugs, that is calcium channel blockers, example verapamil, diltiazem. These are non-dihydropyridine calcium channel blockers, shows greater action on the heart than on vascular smooth muscle, and diltiazem is intermediate in its action. In heart, the verapamil and diltiazem bind only to open the depolarized voltage sensitive channels, thereby decreasing the entry of calcium ion. So these are the calcium channel blockers and they block the entry of calcium channel. Example is verapamil and diltiazem. On the right hand side, how this electrophysiology of calcium channel blockers on its SA node atomicity, ventricular atomicity, ERP atrial avinodal ventricular, ECG RR interval, how it is increasing and decreasing for both the calcium channel blockers have been illustrated with the upward and a downward arrow. Upward arrow means increase and downward arrow means decrease, and only blank dash means there is no change. So this way the various classification of antiarrhythmic drugs with its mechanism of action and example has been explained. Thank you all of you for watching this video. Please go through individual slides of this video. If you have any doubt and any queries, please ask me on the comment box, and hope this video will help you in studying and covering your syllabus. Thank you.